maybe to switch a bit more on the industry topics on the top of Tubulis. I mean, on ADCs, like there are a few things that I find very, very interesting. I mean, we mentioned kind of the GenLab acquisition.
Mm-hmm.
Interesting to see that. Let's say kind of the first real like $1 billion biotech acquisition from a biotech company, at least European biotech buying another biotech. It was I think it was West Coast based. I think they were mostly West Coast based, but it's interesting to see. But that's, yeah. And what's also interesting, or maybe you can comment on this, recently I saw that there was some like less good news on the ADC front. I mean, I saw that like BMS walked away from a deal with Eisai. I think it was a massive deal. It was $650 million upfront only 3 years ago, and they walked away. And then there was this like massive Daiichi Sankyo deal with Merck, with the US Merck, like $4 billion upfront. And then I don't know how many, what is it, $18 billion in milestone, October 2023. But they got a massive like FDA rejection just recently. Can you comment a bit on this, on like what's your feeling? Yeah, where is it? Yeah, what's your feeling about these news? How you read them? Like,
yeah, I mean, of course, there's when it comes to BMS and Eisai, there's probably a lot of things that we don't know about it. In the end, it's always challenging to develop drugs and independent, and sometimes it's not the drug that is challenging, but it's different situations that are challenging. So I don't think this creates a general view on ADCs or has an impact on ADCs. And also Daiichi Sankyo is those guys are leaders in the field. They have a really powerful platform, the really powerful ADCs. But also for them, it's sometimes challenging to, and I don't know the details there, but I think they will solve it. And they will solve, pretty sure.
They have a few billions to solve it, I guess. I mean, they kind of invented, or some of them.
They were the first ones to move topoisomerase 1 inhibitors.
Yeah. Can you talk more about the history of ADCs? Like, because what's one surprising thing is it's not the only, but it's one of the only really biotech bio like technologies that is actually leading from Asia, or coming from Asia, Japan and China, but mostly Japan. I mean, you have iPS cells as well, but in general, there's a lot more from the US or Europe.
Also for ADCs, a way ADCs have been created, or not created, but a lot of pioneering work has been done in the US. Seattle Genetics. They have nobody else before, to the best of my knowledge, but nobody else before Seagen has been doing manufacturing for ADCs. Okay. So they have basically showed us how it can be done. And then we, of course, there's like pharma companies. There was a first wave. Immunogen is. We had.
They went Boston, right?
They were now acquired, but they had so many ADCs in their program. There was so much rich science coming from them. Then, of course, with Elahere being approved, this was a fantastic success for that company, and now got acquired. But a lot of pioneer work came also here from the US.
Because I don't remember the details, but I heard a story that was some Japanese, like in the suburbs of Tokyo, scientist, and he was working with ADCs like when no one at all was touching it, and he was not even recognized. I don't remember who it was, but I
don't know that story. So if you find that again, I will know it with you.
That's interesting, because I think he was like really forgotten, and like no one cared, and then he was working almost solo on it, and for a decade or so, and now more recognition. I will try to find it.